Introduction. Intervertebral disc herniation, IVDH, is a relatively rare condition in cats, with an incidence ranging between 0.12% to 0.44% in those presenting to referral centers. This is significantly lower compared to dogs, which have an incidence of 3.5%. In cats, the types of IVDH vary, and while both compressive and non-compressive forms are recognized, there is no consensus on which is more prevalent in the species. This variability in prevalence and clinical presentation has made it difficult to establish a standardized understanding of the condition. A key differentiation in IVDH is between intervertebral disc extrusion, IVDE, and intervertebral disc protrusion, IVDP. IVDE involves the sudden rupture of the disc annulus, allowing the nucleus pulposus to extrude into the spinal canal, causing compression of the spinal cord or nerve roots. IVDP, on the other hand, is characterized by the slow bulging of the disc into the spinal canal without rupture, typically causing more gradual compression. These distinctions are critical because they influence clinical outcomes, with IVDE generally being associated with more acute and severe signs. In addition to these two forms of IVDH, degenerative lumbosacral stenosis, DLSS, is another condition affecting the vertebral column, particularly at the lumbosacral junction LS. DLSS results from a combination of degenerative changes, including intervertebral disc degeneration, IVDD, spondylosis deformans SD, and other forms of vertebral degeneration that cause narrowing of the spinal canal and compression of the cauda equina. This study aimed to assess the occurrence of degenerative spinal changes, including IVDD, IVDE, IVDP, and DLSS, in cats presenting with neurological signs indicative of spinal involvement. The researchers sought to determine the clinical significance of these degenerative changes and whether they contributed to the cats presenting symptoms or were incidental findings. Study design and methodology. The study was a retrospective review of medical records from Monaco Ars Veterinaria, covering cases from September 2017 to December 2022. The inclusion criteria were cats that presented with neurological signs consistent with spinal cord disease and underwent spinal MRI. Neurological examinations had to be performed by board-certified neurologists or neurology residents under supervision, ensuring a high level of diagnostic accuracy. Study population. The study included 114 cats, of which 70 were males and 44 were females, with a median age of 6.5 years. The majority of cats were domestic short hair, 68.4%, with a smaller proportion of purebreds, including Persian, Siamese, Norwegian forest cat, and others. The cats presented with a variety of clinical complaints, with pelvic limb weakness, 52%, being the most common, followed by paraplegia, spinal pain, and incontinence. MRI analysis and findings. The MRI scans were evaluated using various sequences, including T2-weighted and T1-weighted images, to identify degenerative changes in the spine. The most common degenerative finding was intervertebral disc degeneration, IVDD, present in 64% of the cats. Other findings included spondylosis deformans SD, intervertebral disc protrusion, IVDP, and intervertebral disc extrusion, IVDE. Degenerative changes were more common in older and heavier cats, but no significant sex or breed predisposition was observed. The MRI findings were categorized into three primary types of degenerative changes. 1. Intervertebral disc degeneration, IVDD. This was the most prevalent finding, with 324 affected disc spaces across 73 cats. IVDD is a degenerative process involving the loss of disc integrity, leading to disc bulging, mineralization, or collapse. This finding was positively correlated with age, supporting the theory that IVDD is an age-related condition in cats. 2. Intervertebral disc protrusion, IVDP. IVDP was identified in 29% of the study population, affecting 33 cats. This condition involves the slow bulging of the intervertebral disc into the spinal canal, causing compression of the spinal cord or nerve roots. In the majority of cases, 91%, IVDP was considered an incidental finding, with no clear link to the presenting neurological signs. 3. Intervertebral disc extrusion, IVDE. IVDE, which involves the sudden rupture of the disc and extrusion of the nucleus pulposus, was identified in 7.9% of the cats. Unlike IVDP, IVDE was always considered the cause of the presenting complaint, as it typically leads to acute and severe neurological deficits. Degenerative lumbosacral stenosis, DLSS. Degenerative lumbosacral stenosis, DLSS, was diagnosed in 12 cats, 10.5%. Making it the third most common primary diagnosis in the study. DLSS involves the narrowing of the spinal canal at the lumbosacral junction, usually due to a combination of disc protrusion, dorsal compressions, and foraminal stenosis. DLSS is frequently seen in older cats, and in this study, it was often an incidental finding rather than the primary cause of neurological signs. Relationship between degenerative changes and clinical signs. One of the key findings of the study was the distinction between clinically significant and incidental degenerative changes. In 22% of the cats, the degenerative changes observed on MRI were considered the primary cause of the presenting neurological signs. This was particularly true for cats with IVDE, where the disc extrusion was always linked to the clinical symptoms. In contrast, IVDP was only considered the primary cause in a small fraction of cases, 9%, even though it was present in nearly a third of the study population. This supports the hypothesis that IVDP is often an incidental finding in cats and may not contribute significantly to clinical signs. Similarly, DLSS was only deemed clinically relevant in 43% of the cats in which it was identified, with the remainder being classified as incidental findings. Clinical significance of MRI findings. The study highlights the importance of careful interpretation of MRI findings in cats with suspected spinal disease. While degenerative changes are common, they are not always clinically significant. The presence of IVDD, IVDP, or DLSS on MRI does not necessarily imply that these conditions are causing the neurological signs, and other causes of spinal disease, such as trauma or neoplasia, should be considered. However, the study also underscores the clinical relevance of IVDE, which was always associated with the presenting complaint. This finding suggests that IVDE should be considered a primary differential diagnosis in cats with acute, severe neurological signs, particularly when other causes have been ruled out. Discussion. The findings of this study provide valuable insights into the prevalence and clinical significance of degenerative spinal changes in cats. The high prevalence of IVDD and the frequent occurrence of incidental IVDP and DLSS suggest that degenerative changes are a common, age-related phenomenon in cats. However, the clinical relevance of these changes varies, with only a minority of cases being directly attributable to the degenerative process. The study's retrospective design and the lack of long-term follow-up data are limitations that should be addressed in future research. Additionally, the use of MRI as the sole imaging modality may have missed subtle degenerative changes that could be detected with other techniques, such as computed tomography, CT, or myelography. Despite these limitations, the study provides a comprehensive overview of the types and clinical significance of degenerative spinal changes in cats. It also highlights the need for further research to better understand the natural history of these conditions and their impact on feline health. Conclusion. Degenerative changes in the spine are common in cats, particularly as they age. IVDD is the most prevalent degenerative change, followed by IVDP and DLSS. While these changes are frequently identified on MRI, they are not always clinically significant, with IVDE being the most likely to cause acute neurological signs. Clinicians should be cautious when interpreting MRI findings in cats with suspected spinal disease, as degenerative changes are often incidental and may not be the primary cause of the presenting complaint. Further studies, particularly prospective trials with long-term follow-up, are needed to better understand the clinical relevance of these degenerative changes and to develop more effective treatment strategies for affected cats.